Good morning, everybody. This is Dr. Patmos with an important update. It is April the 9th, 2026, and this morning, the Washington Post is reporting, the link is attached below, that Dr. J. Bhattacharya, the acting CDC director, personally intervened to stop the CDC from publishing results of a study in the weekly morbidity and mortality weekly report. For those of you who don't understand, the Morbidity and Mortality Weekly Report is an essential document put forth by the CDC every week, has been for decades, half a century or more. It's an important publication that physicians should all be reading, that details exactly what's going on with infectious diseases in the United States over the past week and over recent weeks. Well, the Morbidity and Mortality Weekly Report was just about to publish results of a study that CDC conducted that showed that last winter the mRNA vaccine reduced hospitalization by 55% and urgent care visits by 50%. In other words, the vaccine was highly effective in reducing the severity of disease such that you get vaccinated and your chances of ending up in the hospital are cut in half. That's very, very significant. The methodology for the study is the same methodology we use to assess vaccine effectiveness and have for many years. It's a standard methodological process for assessing the efficacy of vaccines. Well, it turns out that Jay Bhattacharya doesn't like the results. He doesn't think the methodology was good. So he personally overruled the scientists at CDC and stopped publication of this information. What this means is that Dr. Jay Bhattacharya, in his sole and absolute power, has decided to withhold information from physicians and from the American public that proves that the mRNA COVID vaccine is highly effective. He doesn't want you to know that because he doesn't believe it and he thinks there's something must be wrong with the methodology. So he doesn't want you to know. He doesn't want doctors to know. He wants doctors to be kept in the dark and not know about this important study. This is outrageous, and here's why it's outrageous. But everybody needs to know this. I don't think people are aware of this, but everyone needs to know this. Here are what Jay Bhattacharya's credentials are. He has an MD degree from Stanford. That is true. That is where his medical education ended. He never did any graduate medical education after finishing medical school. No internship, no residency, no fellowship. He is not board certified. He is not board eligible. He doesn't hold a medical license. He doesn't qualify for a medical license. He has no hospital medical staff membership, nor does he qualify for that. He has no clinical privileges, nor does he qualify for that. He has absolutely no clinical experience beyond medical school. He has never taken care of a COVID patient. He doesn't make rounds in a hospital. He doesn't see patients in a clinic. He doesn't provide any direct medical care, and he never has. He has zero clinical experience, none. His degrees beyond his MD degree include a PhD in economics. His work has been in economics. He is not trained in molecular biology. He's not a biochemist or an immunologist or a vaccinologist. He has no experience in doing bench research around vaccines or epidemiology. He is not an epidemiologist, despite him saying that he is an epidemiologist. He invented a term called economic epidemiologist. There is no such thing. He's an economist with absolutely no training beyond medical school in science or in basic science research. He is an economist, and he is a political uh, critter. He's a political animal, strongly supportive of Donald Trump, and firmly committed anti-vaxxer and anti-mRNA person. He has no qualifications at all for the role that he's in. Imagine being a doctor who has done an internship and done a residency and is board certified and practicing medicine 45 years, having a doctor who never even did an internship determining what you can and cannot be told about a vaccine, shaping what your perception is about a vaccine. This is outrageous, and every physician in the country should be outraged that a doctor who never even did an internship is telling us what to do and what we can know and not know. It's unacceptable. Now, here's the real kicker. He talks about methodology and that he doesn't think the methodology is right. Who is he to talk? He is the lead author of the Great Barrington Declaration. The Great Barrington Declaration is his biggest publication. It doesn't have a single reference. It has no bibliography. It's not based on any experimental data. He wrote an article that has formed the basis of our approach to COVID that was not based on anything other than what he thought. There's no references, no bibliography. Now, for those of you who have children in grade school, if your child was in sixth grade science and wrote a paper without a reference or a bibliography, how do you think that paper would be graded by the teacher? Probably get an F. If you don't have references and a bibliography, then you're just making stuff up. That's what J. Bhattacharya did with the Great Barrington Declaration. He made it up and wrote a paper directing policy that isn't based on a single shred of evidence, not a single shred of published research. The Great Barrington Declaration, which was basically a declaration that said we want people to get COVID, we want them infected, don't vaccinate people, just the elderly, because they're at high risk. Let everybody else get COVID, encourage them to get COVID so that we get herd immunity and then it will all magically go away. We want them. The Great Barrington Declaration has a subtitle called "We Want Them Infected." That's Dr. J. Bhattacharya's contribution to public health. Well, his next contribution is withholding evidence of vaccine efficacy. It's outrageous. And oh, by the way, the Great Barrington Declaration was cooked up in the Oval Office. I've attached a photo below of Jay Bhattacharya and others who were responsible for this approach, sitting in the Oval Office, circling Donald Trump, with a comment from Dr. Atlas, who was bragging about how wonderful it was to sit in the Oval Office and formulate with the president, formulating public health policy. So this is who's now determining what you, doctor, will know about the vaccine's efficacy and what you, American public, will know. Here's the bottom line: he can withhold the data from the Morbidity and Mortality Weekly Report, but the facts and the data have leaked out. The vaccine last year reduced your likelihood of ending up in a hospital by 55%. Let me tell you how hard it is to get admitted to a hospital. You have to be really sick. If you have COVID and you show up in the ER, most of the time, you'll be given Paxlovid and sent home. In order to be admitted, you have to be in pretty severe straits. You have to be hypoxic and at risk of death and worsening condition if you're not kept in the hospital. So the vaccine reduces your likelihood of getting that sick by 55%. This is a very significant benefit. This information should not be withheld from the American public and from physicians. This is an outrage. It's absolutely unacceptable that a doctor who never even did an internship is withholding data from the American public and from American physicians. American physicians need to rise up and object to this and demand the release of the data